I'm Robert Resnik, and I'm Professor Emeritus of Reproductive Medicine at UC San Diego. I've been on the faculty here since 1974, and with close to 40 years coming up. It was our initial goal to cover the basic sciences as well as the clinical areas, so that for a fellow in training, for example, or a practitioner of the specialty, they would be able to get everything they needed from one textbook. And what we did over the years was to bring on new authors with new expertise, expand into some areas that were developing fields at the time, but were not really very prominent then. But we decided prior to this edition that if we were going to have a complete textbook, then we should really take a big step into imaging, fetal imaging, and be able to provide a text which would again be, quote, one-stop shopping for maternal fetal medicine specialists, so that they would be able to learn about the technology and the mechanics of imaging, as well as the management, identification and management of each one of the entities that one can make a diagnosis for about fetal development. And I think that part of this is also spurred by the fact, with a great expansion of an electronic edition, we have the opportunity to put in literally hundreds of images of these entities that would not be we wouldn't be able to put into a print text, as well as video clips, for example, of fetal cardiac lesions and so forth, and as well as 3D ultrasound. So I think that this 7th edition upcoming is going to be a major step forward, because it will have all the updated basic and clinical areas, as well as a complete entity of obstetrical imaging. One of my favorite, but it's probably not everyone's, but one of my greater interests is the appropriate identification of growth-restricted fetuses. There's so many errors made in the diagnosis, inaccurate diagnosis of fetal growth restriction, simply due to the lack of applying appropriate growth standards from different populations of individuals. So that's going to be very strongly emphasized in the textbook as well. There's a lot of things, new areas in the diagnosis of preeclampsia, potential therapeutic measures based on new understandings of the molecular biology of implantation. There are going to be exciting new things about the management of preterm labor, controversies about the use of cerclage procedures for preterm birth, the immunology of pregnancy. The three things that I would emphasize again are this a very aggressive update to make sure that everything is timely, as timely as it possibly can be, number one. Number two, we're going to be updating it very, very aggressively during the 4 or 5 years before the next edition comes out. I think the third major change, as I mentioned before, is this entire new section on imaging, which will make it now a complete text. And I think finally, the ability for people to walk around with a tablet and be able to access all this information seamlessly. I think that's going to be a big step forward.